Did you hear me? Excited. Excited. We're excited. Instead of saying nervous, guess what? You say excited. I'm excited. And I realize that the more nervous or excited I am, it just means I care so much. And like, I just want to make sure that I, Shallow. And I'm doing everything. Okay, I'm going to hit join right there, right? Shallow. You can join the TBI Med SLP webinar info on my resources. Brandon, shallow. Okay. Once it is going to start at the top of the hour. So like, I'll be really there. That's why I was in fact writing this. Cause, oh shit, I should probably actually write more of like the resources. No, don't hide it. Wait, look, Brandon, let's do that. Okay. I am on the TBI Med SLP webinar. Info is here, and then website 1. Okay. And I'm going to try and have that like pinned so then when people come on, they're not like, what the hell? Why isn't she paying attention to us? Right? Okay. Yay. We're learning new things. We're trying new things. You can teach an old dog new tricks. You can have a brain injury and start teaching yourself and doing some cool things. Okay, we're still 5 minutes early. I'm just going to press join. I just muted myself. Oh, I just got really nervous. Am I supposed to be in this thing? Wait, is my volume up? Oh, wait, now it's on. I don't know. I don't know. I know I'm early. So I hear clicking.
Tawny, when you came to join the meeting, did it give you the option, like next to join, like to present? Are you on a computer?
I'm not. Do I need to switch to a computer? I'm on my phone. I can switch to my computer. I honestly just pressed join. I didn't really look to see if there was like an option.
I didn't hear anything you said. Oh, hold on. You go ahead.
I'm on my phone. I can switch to my laptop. 2, I didn't even see if there was a button to join as a presenter.
Okay, you're
clicked
perfect
join.
then. Because I'll make sure everyone's muted because you pop up then. So okay, perfect.
But like when I came in, my microphone was like unmuted. So like I just muted myself because I realized like, I don't know, old habits.
Okay, cool.
Okay. So this is okay. Awesome. Yay. Okay. I'm going to shut that off for a second. Guys, okay. We have it. You're going to be here. I'm going to be right here. You guys are going to be able to see me. This is a good view. Oh no, this is a terrible view. I'm going to get that view better. Look at me. We got to get this view much better. Ooh, where do I need to put you guys? Oh no. Because you can see the mirror. I guess that's fine. Look at me. That's okay. Shallow, we're early. You guys are early if you're on. I kind of wish my background wasn't. It's like you see the mermaid thing, whatever. I feel like it's fitting of a brain injury survivor. I could put on one of those fake backgrounds, but I like being authentic, so looks okay to you guys. I'm excited. Oh, shh, Ella, it's okay. Hey, Ella, it's okay. Shh. Hold on. Oh my gosh. Really? He never comes on a Monday. What's going on? Oh, okay. This is gonna be funny. Okay. It's okay. Whatever, right? Okay. There we go. Is that okay? Hello, guys. I can't see here. Like Brandon was on. We're on different platforms, but if you comment, I will be able to see your comment. Oh, sugar, did I not do this? Oh yeah, go live. Am I on Instagram now too? That's so wild. Okay, we have responses right here. We're gonna just slide this over just a wee bit. And I can do things like, I don't know. Oh, there's my leg. Okay, but I'm gonna be focused here. Yes, okay, this is good. You guys are good. I'm super excited. I relax my shoulders. I just now was like, wait, where's my Google Keep? I gotta let that out there. Oh no. That's not the face we want to make. This, I love it. This woman isn't moving before 5 on the dot. Perfect. Where is it? Oh my gosh. Oh, Chris, you're so sweet. Okay. I got all nervy. That's awesome. Okay, wait. I gotta put this back down. All right, we're not gonna keep moving things. We're gonna just chill out. Should I unmute? Shallow, shallow.
Hi everyone. Sorry I look insane. This woman waiting until 5:01. She was not leaving this room. So I am excited that you all are here. And Tawny, I'm even more excited that you're here. And you are going to share your story with us and then give us the opportunity to ask you questions. So we'll go ahead and get started, and I'm going to mute myself and give you the floor to share your story.
Perfect. First of all, thank you so much, Tracy, for giving me this opportunity to share my story in this way. So I have had migraines since I was 15 years old. My mother started suffering migraines when she was 30. I had a neurologist. So when my neurosurgeon in Ohio suggested that I go get an MRA, I was like, oh, I've never heard of that. Okay. I asked for it. My insurance denied me because I was 28 years old. And I went about my way. I was a special education teacher and I went to school that day. It was Cinco de Mayo. Um, I had a migraine, which wasn't that different of a day. And while I was at school, everything was fine. I went home. I told my brother I'm going to take a shower, and then I wanted him to drive me to a friend's to drop me off for the holiday festivities. But when I was in the shower, I had the thunderclap migraine, worst headache of your life. If I wasn't in the shower, I honestly would have thought somebody hit me with something because it hit me so hard I caught myself in the shower. I'm luckily 5'11", so our shower doors, I caught myself, and I remember thinking I have to protect my head. I can't hit my head. And so I slid down and I began to just feel just the most excruciating pain I've ever experienced in my life. And I now know I was having mini seizures, but at the time I somehow justified that I was wincing in pain. I yelled for my brother. I finally started pounding on the bathtub, and I was still cognizant enough to joke with him to say, throw me a towel. I don't want you to be scarred for life because I was in the shower. And he helped me sit up and he put his arm around me and he goes, I can carry you. But I was like, no, I'm fine. So I was able to walk, but I needed assistance. I immediately noticed how light sensitive I was. So, like, I screamed that he had to close the blinds. I puked, which I've never puked from any migraines before, which I later told an ER doctor. All of these things with the addition of telling him as we were driving to the emergency room that I saw a semi in front of us and I knew that highway and I knew that there was not another highway. I was like, I'm seeing the exact same semi. So I'm seeing double now. And at that point, I was also sleeping a lot. I couldn't stay awake. And my neck was really stiff. I couldn't even look down. My parents actually, the reason they took me to the emergency room was they thought I had meningitis. So I told a ER doctor all of those things. He saw a 28-year-old, so he decided to shoot me up with the nerve blockers instead. Here, and then the back of my head. Um, I obviously felt a little bit of relief. I went home. This was on a weekend. So I called my regular neurologist. He was out of the office because it was a weekend. So I got the auto service. Monday came around. He heard that I had seen the ER. So he prescribed me a steroid. I felt excruciating pain the entire time. I felt like something was not right. But I just kept saying, the doctor saw you. Like, what else are you going to do? So I called my primary doctor, and on Wednesday, I was able to see him. He said, I'm not a neurologist. I don't know what to do. So he prescribed me my allergy medicine and in shot form, and we tried that. So come to Thursday, I wake up and my left eye is crossed in, and now I'm knowing that this is not something normal and I should go to the emergency room. So I look up a different emergency room that has my insurance. We drive there. Luckily, I start telling that ER nurse, and she sees my eye crossed in. And so I immediately got scanned. They told me I had a subarachnoid hemorrhage, and that at that hospital, there was not a doctor there that could perform the angiogram or the surgery that I needed. So they life flighted me to the Cleveland Clinic, where I luckily had a coil procedure, but they said when they went in there that I was still rupturing. So that entire week I was bleeding. So they were not able to put a stent in. So after that surgery, for the next 6 months, I was getting scanned every month to see if the coils were holding, if my built up spinal cord fluid was going to go down. Luckily, it seemed like everything was holding tight until about 7 years later on my anniversary, we found that there was another brain aneurysm and my coils were slipping. So in June 12th, I had another coil surgery, and this time they put the stent in. So in June, I will get my 1 year follow up. Uh, this second time catching the brain aneurysm before it ruptured, I only spent 1 night in the hospital. Uh, no PT, no, nothing like offered after. Like, you're good, you're gonna be great, back to normal. I know I jumped over and forgot to say the first one. Um, I was never offered a speech, actually. I was only offered PT for my eye being crossed in. I do remember asking and complaining as a special education teacher. I said, I know my executive functioning is off and I'm having difficulty with my emotion regulation. And they told me, if you can say executive functioning, like, you're doing great and you're fine. So I now like to speak up because I know with neuroplasticity, you can work on things. And I'm here to help advocate for those of us who are young and look fine on the outside, but on the inside, I may talk really fast, but I don't process nearly as fast as I did before. So I think I tried to sum it up pretty quick, the 2 surgeries and the rehab.
So, I'm gonna start by asking a question. Well, I mean, there's lots of questions, but some of them do not have answers. They can only have excuses because an answer to those questions would outrage me. Um, do you, I'm so sorry for your experience. That is unfortunately healthcare in America. And I am so proud of you for sharing it and going through all that. And even after your first one, you were only offered the physical therapy, right?
Yes.
And what kind of, was it an outpatient physical therapy?
It was outpatient. And in the beginning, I think it was every day, and then it spaced out, but it was primarily just focused on my eye and my balance. Mm,
Like when you were discharged from physical therapy, did you feel like you were really done?
no. I kept saying, like, but I'm not, oh, like, I need more help. Like, I don't feel like this is right. Like, even my mom was like, "Are you sure she's okay?" And she's like, "'Cause she just doesn't look okay." Which,
That makes me so incredibly sad and really frustrated for you. That's not the way it should be. That's not the way good brain injury care should be. That's ridiculous. That's some horse shit is what that is. And I don't have any better term for it because there isn't a better term. So hopefully I didn't offend anybody with my terms. Do you,
it's sadly very common though. I just
that's what
feel
I wanted to ask you. I know
like
that you are close in a big network of survivors. And so, and
it's
you took even like a Google survey form. So do you mind sharing a little bit about that with us?
I absolutely do. That seems to be a lot of the complaint is, first of all, talking to us, which I experienced too, being in the appointments. And yes, I understand my processing might be slower, but to just blatantly look at my mother and act like I'm not even in the room, um, is so belittling and upsetting. And it's like, I'm the patient. And like, I would tell my mom a lot of times, like, I feel like I already have to fight against my body, and then I have to fight against the receptionist to get seen, like, because they just see this young girl, like, a lot of time, they would be like, "You're in the wrong place." And I'm just like, no, I think I'm supposed to be here. I don't wanna be here, but I am." And, I mean, to the point of, I know I wear makeup and I like to dress up. I had one say, "You can't be that sick if you look like that." Yeah. So I would like to say that it's uncommon, but also in that Google survey, some people did say.
Has that person ever heard of, sometimes you have to, obviously I chose not to do this today, but sometimes you gotta look good on the outside to make yourself feel a little bit better on the inside when it's real bad. No, you haven't had to do that, then you must have had some very easy experiences.
You're lucky. And also, I said, when you're on bed rest and the only place I get to go is to the doctors, this is my outing. This is my outing for the week. I don't get to go
Exactly.
anywhere else. And like, I wanted to not just look like how I look every day. So, of course, my computer's freezing right now. Some of the responses. Oh, man. Does anybody know on a Mac how to make the mouse move if it doesn't want to move?
Is it a wireless mouse?
No, I don't even have a wireless. Like, I joke it's the cyborg in me. Oh my gosh. I don't know how to get it.
I don't know what I would do in that situation.
Okay, here. Luckily, we have a handy dandy iPad.
All right, sorry, I have a Mac and I would just cry.
Luckily, when your brain short circuits a lot, I'm fine with technology short circuiting. Okay, but how do I figure out how to do that? Okay.
Stephanie, go ahead.
Hi, Tawny, would you like a question while you're pulling it up, or am I taking you away from?
No, that would be great.
Okay.
Because it's loading. So thank you.
So, as Tawny knows, fellow brain aneurysm rupture survivor and stroke survivor, did they, I don't remember if I ever asked you before, did they have you even do a swallow test?
No, what's funny is because I talked so fast and like they just kept saying, wow, you're so with it, that I feel like so many of the things, like my OT when she came and I had my hair French braided, she's like, you did that? And she's like, I'm crossing off all these things and I don't even have to test you. So I think because I presented so well in certain areas that they didn't think to notice the other things. Like I never had, like, I didn't realize with speech that some of the things could have been worked on, like my aphasia and everything they were like, you're fine, you're talking fine. But when I'm really tired and when I do too much, you can tell, and you can tell I repeat myself. And I'm sure those of you guys who study it, with talking long enough to me, you can tell. Strangers can't. A normal person can say I'm fine. I say it's just kind of like, I feel like I was on the dean's list, so I was highly educated. And I feel like I just sound like a drunken idiot now all the time, but I roll with it. Thank you. So no swallow test. They didn't do any of that. I don't know. Did you ever have outpatient speech therapy? No. And then I think around year 2, I started talking in the community, and they said insurance wise that I just wouldn't qualify. So like you're too far out to apply for that, which now I know, which if you are a survivor, please don't hear that and think it's a no. Please ask other people. Like I'm looking.
That's a fact. Like what she is saying is true. Like that's not a real thing. Find a different provider.
Okay, thank you.
Because that's not true.
And that's okay. So I did pull it up. It was, some people were saying, I wish that the entire team, from physicians to techs to therapists to even support group leaders, were all able to work together to share information and to do so eagerly. The fact that folks like TBI, MedSLP exist to ask what the community needs is a tremendous asset. Patients should have a full understanding of the kinds of therapies available and why they can be a benefit. Conversely, patients and patient advocacy groups should seek out information on how to better communicate their needs once they are sent home. If we knew how to better navigate the system our medical teams were subjected to, we could better advocate on our own best care. I think that, because I know as a patient, a lot of time I came with a binder of my information, and even though they were supposed to send the information, they're like, I didn't get that. I didn't get your most recent scan. I don't know that. So I feel like we spent half of my appointment explaining what they were supposed to already have. And them basically, like, I was like, well, like, I'm the brain injury survivor. I don't know why you're asking me. Like, is this not between you guys? Like, I don't know why you're giving this to me. So my mom luckily did come to a lot of appointments with me, but I also know in the community that's not always possible. And that's exhausting to my mom. Like, I know that, you know, her job gave her a lot of grief for her having to take time out of work to take me to multiple appointments. And also I had an issue with the fact that a lot of times I know you feel like you're saving time by looking over our chart while you're with us, but the amount of times that my chart, I was sound sensitive, and I had doctors come in there screaming, or everybody come in, and they would be like, oh, I see here, oops, that you're sound sensitive. And I'm like, if you would have just taken like a minute to look that over, we could have come off on like a way better, me not wincing in pain. So I feel like the fact that the paperwork is there, and that if they could just kind of get on the same, I don't know, system. You guys all seem to have some different system.
I think it's that there's some providers that legitimately read every line of it, and there are some that read the first 2 lines. And I'm just being, and please, other SLPs or providers that are on here, feel free to echo in, but that is my experience, because I had an experience with a doctor not too long ago that I had read the whole history, and he had read the first few lines, and when we both got in the same room, I was prepared and he was not, and he looked kind of like a fool. So
okay, a lot of people agreeing.
And it's not always just, I mean, like, there'll be there, you know, but I think yes, I think that's what part of the problem is. It's not the whole problem, which I'm very sorry for. It's just, it's inexcusable.
but by talking about it, hopefully we can change it. That's why I'm like, hopefully.
Right, exactly. Like, knowing that is directly coming from survivors themselves, like, gives, because it drives me crazy as a survivor and a provider, because I'm like, you should know some of these things. Like, I'm not a doctor, and I should. It's
like night and day if the chart is read ahead of time. Yeah, that, and
it's a different experience. Like, it just, you know who you're going in to meet.
Absolutely. And you feel informed. And that's what somebody else said, that they take you seriously and listen. Nobody talks about post brain injury life. I know that they were so focused on the physical that I might burn myself. I might not be able to temperature gauge, that, you know, I'm more likely to fall and all of those things. But they didn't warn my mom of the emotion regulation and the mood swings and the crying and the depression, and it to have those things covered. So a couple people did mention that, and like not to rush recovery. Wish they told me how patient I really need to be with myself, and just stressing those things. So I'm trying to summarize instead of just read what everybody said.
No, I think that's great. The hospital I work at now, but this has not been the norm, has specific brain injury education that we give to every brain injury patient. And it has to do with TBI and emotional issues, TBI and behavioral changes, sleep changes. And so that is one thing I will say that's good about where they had those systems in place, and it's part of a checklist for a certain, you know what I mean? And so that is something that, because it's important, like you're saying, like, you know, once you walk out of the hospital, nobody taught you how to do any of this.
And I mean, I know there's no guidebook for everyone, but a little bit more. So it's nice to know that you cover that. I see Dina did ask, what are ways that patients can best prepare for a speech therapy appointment to make sure that the small amount of time given is used to the best of everyone's ability? Ooh, that's a good question. I don't know. I loved going to speech with the kids that I worked with. I wanted to be a speech. Actually, what's crazy is that's what I was applying for my master's, was in speech pathology before the stroke. Probably a Tracy question.
But Dina, so kind of referencing what Tawny said, do your thorough chart review beforehand. And, you know, I think there's always so much pressure to get a lot of things done in one therapy session that, you know, sometimes what patients might need is part of what we provide is counseling or feedback or support. And you might only get one thing done or a half a thing. And so I think being able to know your patient ahead of time and being able to read them and read the room and kind of intuitively, and it might take time, but and also talking to them, you know, there are patients that are always going to say, no, I don't want to do that. So you obviously have to take that into account, but, you know, asking them, you know, how their day is going, getting a sense of what they're probably going to be most productive with. Like, is it going to be a structured task, or do you need to do something that's, you know, also maybe a dual task activity that's going to challenge them physically, give them a little distraction, and also work them cognitively. But I wouldn't worry so much about how much. I would just focus more on what you do, if that makes sense.
I really like that. Oh, and Karen said, I know I'm backtracking a little because you were talking about before how people think you look fine, so you must be fine. What is a way you have found to be most helpful and impactful to explain your more invisible injuries to other? I have found explaining to everyone neurofatigue in the way of, I go, you know, after you've been at an amusement park and you're just sensory overload and your body's exhausted and your brain is exhausting you, like hum. I go, that's how tired. I go, and then add in you're sick and like a brain fog has been helpful in explaining that. But like this summer, I was helping my mom and my grandma weed, and then I went to mow for a little bit, and it just made me feel so woozy and weird. And like my mom was like, I don't understand why that was like weird for you when you were pulling weeds that is like up and down. So, I mean, we're still 7 years out and working on that. I will say the processing has been her just seeing it in real time. Like at the doctor's, I will say, yeah, I get it a lot of times. And then on the drive home, I'll be like, hold up, did he just say that I might have to have another surgery? And she's like, yeah, that's why I was saying that in there. So that's something I know now with the online stuff where you can ask questions is a lot better, but I sometimes wish that instead of asking me questions at the end, like I feel like every appointment was at the end of it, it's like you can ask questions, that sometimes by the end of the appointment, even though I have a list of questions, my brain is so overloaded with information that like I would sometimes not want to ask my questions. I'd be like, no, it's fine. And so I know that we would suck up a lot of the appointment. So I get why you put the questions at the end. However, sometimes it's just like, even though I'm all there, my processing, and when you give me way too much information, I kind of just shut down. And people now I warn them ahead of times. I just tell people that. I go, listen, I'm really helpful, but like if it gets too chaotic, you will just see me start to shut down and remove myself. So you have to either be like, Tawny, like we were unpacking a moving van and I'm like, I need you to tell me and not be like, grab this and move that. Like I'm like, I can't play Tetris over here and be moving my body and answering things to you. That's too much things being inputted at me. Tawny, thanks for sharing your story. If you could go back and attend speech therapy as an inpatient or outpatient, what kinds of activities, tasks do you feel would be meaningful? I do little brain tests at home. Like someone was like, can you count to 25 and say the alphabet? And like I realized that I struggle at those and my memory. So I mean, I don't know the exact test. Like I would be willing, and that's what I want to do actually, is find someone and just assess me now and see where my deficits are because I know that they're there. I just I don't know exactly. But task wise that I would find useful, and maybe that's why I like social media, is having messages and making connections this way because it helps me work on my memory and like getting people's names right. Like on Instagram, people have, you know, whatever handle name, but then what is their real name? So my brain's having to make the association between like so and so is so and so. So I like kind of real life activities and tasks versus if you just gave me like memory cards and made me flip them over. Yeah. Did any of your physicians ever suggest that you have a neuropsychological evaluation? I actually asked, and that was interesting. I didn't like my neurologist out here in California. But with COVID and everything happening, they basically were like, if you try to find a new neurosurgeon, they'll have to apply for your scan. And so I was like, I'll just stay. So I found a new doctor who actually was like, why haven't we checked in the fact that you have sleep apnea or these other conditions? And I was like, because they literally were like, we can only deal with one thing at a time. Like, let's handle your brain and then we'll handle the other things. So he finally is like assessing me as a whole person. But I will admit it was a little disheartening that when I said some of the things, he was like, well, you'll have to get testing and stuff like that. And I was like, of course, I want those testing. Like, I want to see where like I know that I've been functioning and everybody thinks that I'm okay, but like my husband, if the amount of times if the fridge didn't make that beep beep, I would probably ruin food or like I leave the gas on the stove or like he found a plate of chips in the cupboard not in a microwave or in the fridge like I put the remote in the fridge like I'm I say the lights are on, but not all the switches are connected anymore. And so I would love to have, yeah, selective attention. I would love to have somebody evaluate the areas that I could improve on, besides me just self-assessing. I did, in fact, because I was a teacher and I hadn't been at the school long enough, I actually went back to work in just a couple months against doctor's orders. So he actually like I had a note where I could only work for 5 hours, just so that I couldn't use any more sick days or qualify for FMLA. That's a whole other side note. But I did actually by December of that year, I was back to working full time, bartending. And everybody is like, but you were sound sensitive. I go, I just forced my body into it, but that was I had a lot of pain. And I look back now and I wonder how I know a lot of that was self-inflicted by me not slowing down. I kind of learned I was so worried about having another brain surgery and that I wouldn't come out the same that I had this unhealthy relationship of if I just work really, really hard and stack everything away, then if I have to have another surgery, I'll be okay and I won't have to rush back to work. And now, luckily, after the second brain surgery, I've learned as long as you are on top of your things with doctors and all of you amazing medical professionals that we can get through it, and it's amazing. And so I realize that pushing yourself, it's a marathon, not a sprint. And that's one thing I do wish would be talked about more is I know that we do have to push ourselves. However, hearing that I need to get like giving myself an expiration date of 6 months to 2 years did more harm than good. I feel like it pushed me to push myself a lot harder in certain areas than to just let myself heal. And that was actually a couple other people's don't rush recovery when they so other people wish that they didn't get that time frame. I had the questions and I just lost them. I just lost the chat. I had it up here. I apologize. I'm like, I don't know how to.
I will read you a question from Karen. Was there anything that your husband found really helpful as a care partner?
Yes, he knows. He watches my cues. Like he's like, I can tell that sometimes if I bring something up to you, then like I like to bring it up to you again. Um, he's also really good at judging like when I'm getting overstimulated or knowing that like on trips, on vacations, a lot of times I'm like, I want to go home and see my mom for 2 weeks. And he's like, that's kind of a long time. And I'm like, no, it's not. I'll be fine. And, like 10 days in, I start being like, I need to be home. So I say that he knows me better. So he's really good at helping a lot of times without asking. Because as I'm trying to stop saying survivors, as warriors, we struggle at asking for help. And I just say most individuals, I would probably ask a poll of you guys, how often do you ask for help? You probably have an easier time saying sorry, saying thank you, um, apologizing, but asking for help is something that we don't innately do. So he a lot of times won't wait to see if he won't ask me, are you hungry? He will just bring in a plate of food. He will know, hey, she hasn't really eaten or she seems really stressed. Maybe I should do this. So, same thing with my mom. A lot of times with my balance, she would put her hand out and I would be like, no, I'm fine, and try to smack it away. But she would always still be behind me with her hands like ready. So, I just think being a supportive person by continuing to offer the support despite the person saying they don't need it. And also, all of my doctors when they and anybody involved when they slowed down and explained things in normal terminology, not using any acronyms or medical jargon because we don't understand that. Using a lot of analogies really, really helped me. I mean, my neurosurgeon telling me that he was a glorified plumber, I think is still one of the funniest things. So I found that to be helpful.
All right, next one. Based on your experiences, what advice would you give to a brain injury survivor who is about to discharge from the hospital?
I would definitely ask for a copy of everything before you leave that hospital. You can get copies of, your MRA, all of those stuff, but you have to fill out paperwork and all of these other things. So I'd ask for a copy of everything. I would ask what your care plan is, where the next appointment is. And I know they always say like it's in your chart, it's in your e-chart. But like I like to have actual paper printouts in my hands because as a survivor, and I put that all in, I said a folder, a trapper keeper, whatever you want to call it, that you put all your stuff in there, would be a big thing that I would suggest. And finding what communities. So asking, do they have a place for you to have a support group what is, and I would, now that I know, I would have asked, who am I going to for speech? Who am I going to OT and PT? I would have demanded it. Yes, I did say trapper keeper. I'm showing my age. I don't know what the kids call them these days. um, and we had a notebook that was really helpful. I know nowadays everybody, you have your phone and you have your note section. So that, and leaving the hospital, I don't, you know, I think that's it for leaving the hospital. It's definitely the day to day of reaching out. I wish I could get this back.
All right. Rahan, sorry if I said that wrong, by the way, said, hello, Tawny. Thank you so much for sharing your story. Going back to what you were saying earlier, I'm sorry to hear that your doctor wouldn't really acknowledge you and when you visited with your mom. Do you think this is a common thing with patients when patients are trying to receive treatment for neuro-related conditions?
100%. That's why I was actually triggered by somebody else saying that, how did they say? Often they communicated to my caregiver and not me directly. I was not processing or remembering anything, but I'm very independent, and that made me feel like I was not in control of myself, which added anxiety. And that's not good for recovery. So I know it wasn't just me. I also know this isn't on the same, but somebody said that their first OT that they worked with just said, "Have you tried coffee?" In an assumptive tone when I explained how tired I was to her. Coffee helps, but shouldn't be the solution for TBI folks. So just sometimes, the thing, it's not what you said, it's how you said it. So I know that my mom goes, when I was on a lot of the medication, she goes, you just have this very glassed drug look that you can tell that you're not quite with us. And so she goes, I get why they're doing it, but I go, it's just it's just politeness. When you're in a room of people, you don't just completely ignore a person, especially when I'm the person we're talking about, and especially when you're going through something where you already feel like you don't have much control over your body or what's happening to you. And sometimes you say things that you think is correct, but you look around at a room of people looking back at you like, no, it's not. So you already feel like a stranger in your own body. To then have people not even acknowledge you is really frustrating. So I know that that is actually a common, I mean, I've even experienced it with my grandpa sometimes when the doctors come in and talk to them. So I just know that when people deal with neurological stuff, I know if you look on the chart, you think they can't understand why does it matter? Because it does matter, because I'm still the patient, and you don't know when I am with it and coherent and what I do remember and what does make me feel heard and seen.
I can relate to that from both sides of the table. So our last question for you is from Karen. So she asks, in your experience, have you found any benefit from virtual support groups, in-person support groups, reading books written by stroke warriors, etc.?
All of the above. And it's all different. Maybe you love to read and you first just want to read from all the other survivors. I know for me, virtual support groups have been so helpful. They fit into your schedule. And what I love is a lot of times, I mean, I'm a talker, so I do love to share, but also there's a lot of time I like to just listen. And I really wish I would have done more in person earlier. I just kept hearing how different I was and that nobody else was that way. And I don't know, I crossed in, everybody else is crossed out. So I kept hearing how different I was. So I really did not reach out to the community thinking that I would get support or that I could give support. I really was like, you're too different. How can you help anybody else? And then luckily, through meeting more survivors, what I've really learned is what makes us similar is that we are also different, but we do battle a lot of the same problems. So I finally did my first in person last September, and I wish I would have met everybody way sooner. It filled my heart so much. And since then, I keep trying to meet other survivors. I think it's very important. Our diagnosis makes us feel very isolated. And then the doctor's appointments and everything just makes you feel like I'm so different. And I'm so like that word just is ingrained in everything. And the I don't know, I don't know. And so having other people that sometimes you can just say things to and you know that they're not going to judge you, they get it. And also they do have really good suggestions. And I have learned more things to ask my doctors, honestly, from the support groups, like just learning, tips and things like I didn't know that. I personally reading books, it's funny. I'm actually in a book with Maddie, her survivor book, and I have not read the whole book. So I'm just gonna call myself out there. Uh, that is one area I haven't something about reading the lines and then it starts to give me a headache and I'm just like not a fan of it. So I like reading people's social media stuff and their stories. So if you can give it to me in like a little blog, I will read it. But if it's a full book, I'm not there yet. Are there special virtual groups you will find to be more beneficial? I am very partial. I love TAF. So the Aneurysm and AVM Foundation, I have found a beautiful home there. I love that we have a support group every Thursday. I feel really supported there. In fact, my second brain surgery was completely different. Not only was Dina, the director, she knew my doctor. She hopped on a phone call and was able to explain after my primary doctor called. We did a virtual appointment, and she goes, it does seem you have another aneurysm and your coils are slipping. So you need to follow up on that. And then basically ended the call. So I was spiraling, what's going on. And the fact that Dina was able to talk to me, and she's not a doctor, which she says all the time. But what I just love is people who will give you the time to listen and let you vent and then ask you, like, do you want me to problem solve? Do you want me to give you solutions? So I know that there are a lot of different places and things out there, but having real people who have actually, and I love that she empowers a lot of us survivors and warriors. So that's where I love. I also know that me and Maddie are doing more things, a survivor summit in New York and then one in LA. So one really cool thing is there's so many of us out there sharing our stories and trying to come together. So the more of us doing that, the better. So if you find one that you love, go for that. Also, I think it's really cool to be able to, I think of it just kind of like restaurants. Like you can eat at a whole bunch of different restaurants. There's nobody who's like, you have to only hang out with us. So that's what I do love about the community is we do love to support and encourage each other because we're all fighting all these crazy battles.
Well, I love that about support groups. I think they're great too. Thank you so much, Tawny, for your time tonight and for your vulnerability for us to ask you questions and all that information you got from survivors, because it truly opens our minds into how we can improve. Some of that is, and I can say probably everybody on this call was thinking, that ain't right. But we know it happens, and that's why we work to try to
Change
change it.
Exactly. I'm like,
So
that's why
thank
we've got to
you.
get loud. So thank you so much for the space and
You're
the
such a
time. And
badass.
thank you everyone for being here and the questions. My DMs are open so that I am here to connect. I say that it happened for me and then it happened the second time to just make me get louder and raise more awareness. So yeah, that's why I'm here.
Well, thank you so much. I hope you have a wonderful rest of your night and I will talk to you, I'm sure, very soon.
Okay, appreciate it. Thank you.
Bye, guys.
Bye, guys. Oh my gosh, guys, my computer's still frozen, so I don't even know if I'm still live with you, okay? I don't know what happened. I don't know if I'm even on screen. You're probably like this whole time you've just been looking at my fucking ear. I don't even know. Oh my God, I cried a lot. I hope I did okay. Look at me. Now you guys get to see. Fuck, am I still alive? This is the anxiety that Tony has. I'm like, oh my God, was that good? Did I suck? Did I do okay? Am I live right now? Am I live right now? Is this live? Let's see. Is Tony the neuro? Oh shit, she is live. Oh, I'm looking at myself. I can't close this. Look it. Oh, wait, you can't see that. I don't know how to make you see that, but I love and appreciate you guys. I guess I'm just gonna do a system. Oh my God, there it is. Oh, Ron. Ron, what? Guys, it's stuck. Oh my God. Okay, this was a whole hour. All right, we're just gonna, I guess, shut down. System shut down. Is this how we end it? Y'all, what the Come on, keyboard. What's going on? Okay, there it is. Okay, come on, just slowly. Over here. Just gonna. There's a solar full moon. If you guys can see. I know me doing this isn't making magic. Oh my gosh. Oh. End stream. End stream. Okay.